Hi, everyone. This is Sharina Higgins from the National Center for Medical Legal Partnership. I would like to welcome you to our MLP LegalServer training. Thank you so much for joining us this afternoon. We're really looking forward to the content that we have to bring to you today. Before we get started, I just wanted to draw your attention to the chat box on your screen. You are able to ask any questions to our presenters during the course of this webinar, and they will answer your questions throughout the session as well as at the end during the question and answer session. Everybody will be in listen-only mode to limit any background noises, and please just utilize that chat box, and we're going to make sure that we put some resources in there too during the session so that you have access to all of the great things that we're going to be talking about today. So this session is going to be co-hosted with NLADA, and I'm going to go ahead and that's the National Legal Aid and Defender Association for those of you that aren't familiar. Today we are joined by Ariel Altman and Radhika Singh Miller from NLADA, and I'm going to go ahead and pass it over to them now. Thank you.
Thanks, Sharina. And thanks to the National Center for allowing NLADA to co-host today's training. For those of you who don't know, the National Legal Aid and Defender Association is a membership association for legal aid organizations and providers, and we provide resources, training, technical assistance, and support for legal aid to provide services to low-income and vulnerable people. And that's kind of where we come along with our partnership with the National Center for Medical Legal Partnership to support and advance the MLP approach. We're strong believers that the MLP approach enhances the ability to provide human services, not just legal services, to people, and also do that in a holistic and lasting way. We believe that addressing civil legal needs has a tremendous impact on health, and that when partnered with healthcare providers, legal aid can play a critical role in health, as well as reduce the long-term cost of care to patients and providers. And we think this is so great because demonstrating the impact, not just stating the impact, but demonstrating it is necessary and important to build these sustainable partnerships. Data informs healthcare organizations, as well as policymakers and potential funders, which is so important to being able to not just embrace and advance the MLP approach, but to actually fund legal aid as a partner in healthcare. So we just wanted to express our feeling about how great it is that Mallory and the National Center worked with the field and LegalServer to develop these custom fields and the comprehensive guide that we'll be going through today to allow programs to compile concrete and compelling data, which really helps all of our efforts to grow support for medical legal partnership, and to do that on all levels, the local level, the statewide level, and the national level, which NLADA does both with federal agencies as well as national partners and organizations. The guide, in our opinion, just a quick note on the guide, is that it's so important because it's a how-to that makes it doable. It's a tremendous help to not just LegalServer users, but programs that are using other case management systems as well. And there are almost 130 legal aid providers practicing MLP right now. But also a broader message that we think is so important is that it's helpful to legal aid programs that aren't yet practicing MLP because it gives us the tools to build new and sustainable partnerships. So we know that this training will be very useful to everybody, and we're excited to be able to share it and continue our partnership with the National Center and to provide support to all of you as you are practicing and pursuing medical legal partnership. And I think with that, we'll turn it over to Mallory to get started.
Thank you so much, and good afternoon, many of you, and good morning to those of you who are on the West Coast and in Alaska. Thank you so much for joining us today. I'm going to talk very briefly about how this all came together. I'm going to give a quick introduction of myself, and then we're going to jump right in. So I want to say thank you to both the National Center for Medical Legal Partnership and NLADA for supporting and promoting this project. And this project really came together because of both of them. One, because the the idea of having uniform, universal MLP fields that could be collected inside a case management system came together last year while we were at NLADA in New Orleans. And there was just really this groundswell of interest among MLPs to do this. And the National Center stepped in to support putting it together and doing a pilot project with LegalServer. We interviewed a number of MLPs to talk to them about the data that they were already collecting for MLP and the data they wish that they were collecting. And then we had 6 projects that volunteered to be part of a LegalServer pilot. And we've been working on that pilot through the early part of 2016. We did a quick session with some early adopters in June, and now here we are with our official launch. Just a little bit about my background to let you know why this project is so exciting to me. I have been working in medical legal partnership now for about 15 years. This picture here is of the Cleveland skyline. So those of you who know me know that I'm a very proud Ohioan, even though I am not currently living in Ohio. And I have a great love for the city of Cleveland. Those of you who are basketball fans may have seen the skyline during the Cavaliers' victory in the NBA Finals. And those of you who are interested in politics may have seen it during the Republican National Convention earlier this summer. This view is actually from the Metro Health, which was the medical partner for the MLP that I helped start in Cleveland. This was taken from the helipad where Metro Health Life Flight lands, and it was taken by a surgeon who works at Metro Health. And I'll be using various images of Cleveland throughout this training to kind of take a pause and break down what we're going to do into different pieces. After helping start the MLP in Cleveland, I was there for many years. Then I moved to New York City, where I live now, and worked with other organizations, both on the legal and the healthcare side, to start more medical legal partnerships. And then just briefly about my legal services background, I have worked with both LSC and non-LSC funded programs. And over my 15 or so years, I've used 4 different case management systems: KEMPS, KEMP/Prime, PICA, Legal Files, and LegalServer. And I do want to say thank you to LegalServer. They put in a lot of time and energy into supporting this project, and I'm just very, very appreciative of what they did. And I also, in the interest of full disclosure, I just want to let you know that I do not work for LegalServer, but I am currently a consultant. I've been an independent consultant for the past year or so, and a lot of the work that I do involves LegalServer. Finally, I just want to note that we have a very diverse group of participants in this training. We have people who use LegalServer. We have people who use other case management systems. We have partners of ours from healthcare. We have people who are currently involved in MLP, people who may want to be involved in MLP. We have some funders on the call, and we have people representing 30 states and the District of Columbia. So we're just thrilled to have you all as interested and enthusiastic about this as we are. And I just want to say up front that this training is relevant for all of you, whether you use LegalServer or not. We are trying to get everybody thinking about how best to collect data on both the legal side and the healthcare side. For those of you who use the electronic health record, I hope this spurs some thoughts about how you might collect MLP relevant data in there. Okay, so this is one of my favorite photos of all time. I like to start things off on a positive note, and I feel like this little guy could not be more positive if he tried. And I also have been thinking a lot about the Olympics, and if I had permission to share a photo of Simone Biles right now, I would, but I don't, so we've got this guy with us. But I wanted to I've been thinking about Olympic athletes and the amazing things that they do, and how, right now as we speak, they're trying to be their absolute best selves. And so I was thinking about parallels between Olympic athletes and people who are involved in MLP, people who are involved in legal services, people who are involved in healthcare. So in thinking about those parallels, I think right now what we're thinking about, what we're seeking in MLP is how can we in legal services be our best selves? How can we in healthcare be our best selves? How do we fight for and achieve health and health justice for ourselves, our families, our clients, our patients, our community, our country? And the goal with this LegalServer project is really to make it easier to track and record what MLPs are doing, how they're doing it, and which patients they're doing it for. And of course, these MLP features may not be, and they should not be, the most dynamic part of your MLP, but we do hope and we firmly believe that they're going to be an essential part of building a very strong foundation on which you can continue to build. Okay, so let's get to it. What we're going to talk about today, the biggest chunk of time is going to be spent demonstrating these new MLP features in LegalServer. I'm also going to do a quick review of the configuration guide itself, which was written for an audience who use LegalServer, but again, I think will be useful for people who do not use LegalServer. We'll go over the checklist and the instruction sheets in that guide, and then we'll finish off by talking about some next steps and future opportunities. And then I also just want to tell you up front what some of the highlights are, what I hope are the take-home messages for you. First is that all legal services work impacts the health of our communities. And I think that more and more programs that have MLPs and those that are thinking about MLPs are thinking about how to describe the work of the entire legal services organization and the way that it impacts health. And I think that's wonderful, and we fully support and commend that. Then going back to my Olympics theme, MLPs are flying high with style and substance, but we really need to stick the landing. Data is going to be one of the things that helps us stick the landing. And honestly, I think we're behind the curve on where we should be with this, but we have to start somewhere. So then, moving on, I'll also, note that this is an early phase of a long journey. So this is an important first step for us to be taking, but not everything is going to be answered with these features. This is something that we're going to be continuing to work on as a community in the months and years to come. For those of you who do use LegalServer, I would note, it does take time up front. You need to invest some time to customize LegalServer. Both your MLP team needs to invest some time in thinking about what it wants, and your LegalServer administrator needs to invest some time in setting it up. But we do believe that this is going to save you a lot of time down the road. And then as I alluded to before, there is more to come, including sample reports, tracking outcomes, and thinking about ways that we can spur healthcare investment in the work that MLPs and legal services are doing. Okay, here is another image from Cleveland. Murals are my favorite kind of public art, and Cleveland has some wonderful ones. This is from the Collinwood neighborhood in Cleveland. Okay, so the demonstration of the features in LegalServer is going to talk about organizations and contacts, your healthcare partners, and then the individual people within those institutions that refer to you. We'll see a sample referral that's received from a healthcare institution, an MLP intake, an MLP profile view, special program page, an MLP Consults, facilitated referral, and I will define what both of those are, MLP Consults and MLP facilitated referrals, a sample training, and a sample case closing. And I do want to note, for those of you who are LegalServer folks, there's a lot of different ways to set this up in LegalServer, and I have not included every possible setup, and there certainly are alternatives to the way that you can do things. And before I jump in, this is not actually officially part of the configuration guide, but I wanted to note the opportunity that LegalServer and the other case management systems offer us to track where people who call us get their health care. And I think that that's very important to think about and track and document for when we want to go to our healthcare partners and either start up an MLP with them or talk with them about how we're working with the same members of our community. So there is a field in LegalServer, and it would be very easy to build in other case management systems, where you can put a list of, some of the health institutions that serve your community, and you could track that information from all of your intake callers, not just those who are calling or who are specifically referred through the medical legal partnership. So I just put 4, generic names in there, but you could list any number of institutions serving people in your area. Another way to do this is to say we're already helping, 500 of the VA Medical Center. Last year we helped 500 people who got care from the VA. Another way to talk about it would be to say, unfortunately, we had to turn away an additional 150 people who get their care at the VA only due to lack of resources, not because there wasn't important work that we could have done on their behalf that would have improved their health. So this is a very easy way to start thinking about, outside of your MLP, collecting some data that you can then use to spur investment later on. Okay, at this point, I'm going to go and share my screen. Okay, and those of you who use LegalServer, this should look very familiar to you. A common homepage profile here. One of the organizations that I work with is MFY Legal Services. They have a really great MLP with Bellevue Hospital and Kings County Hospital, serving children and youth who have mental health conditions. And I'm going to be using this as the base, but it can be customized, as we've talked about, in a lot of different ways. So just very quickly, in LegalServer, you can designate an organization as an MLP medical institution. It could be other types of organizations compared to you, a referring organization, a referral organization, medical institution, whatever. But if you add MLP medical institution as the type of organization, then you can easily pull that up when you're tracking things in cases and so on. I do want to note it down here at the bottom of this organization profile. LegalServer built us 3 very cool list views, where you can see all of the open MLP cases for an organization. And I am a Harry Potter fan, so all of the cases that we'll be looking at today were opened up in the name of a character from Harry Potter. You can see all MLP outreaches. For those of you who aren't familiar with LegalServer, an outreach is basically anything that's not a case. And then you can also see this list of medical departments. So within a larger medical institution, you may work with a number of different departments or locations. So you can see here a pediatrics department, family medicine department, and then a community health center that all fall under the same organization here of Metro General Medical Center. Okay. Then also you can add individual contacts if you want to track the individual healthcare providers who are sending cases to you or trying to consult with you on their patients. And I put in Megan Sandell as the outgoing medical director of the National Center for Medical Legal Partnership. So I put her as my contact. And then you can see here she's a medical provider, and then she is affiliated with the organization, the healthcare organization. All right, next I'm going to go and talk about how you could track referrals received from your healthcare institution. So some MLPs get their patients referred directly from the healthcare center, and the healthcare center may refer via fax, they may refer via email, they may just have paper that the paralegal or attorney goes in and looks through, and you could be putting those into LegalServer and tracking them that way, which would be more accurate, I think, and then also can save you time for the intake, because some of the information that you're entering into the referral then converts over when you open an intake to talk directly to a patient. If you are a LegalServer person who uses the online intake module, you could also build this out so that your healthcare partners could directly enter the referrals themselves through that module. So you could just click here to record an MLP referral received. I'll click over here so you can see a little bit about what it would look like. So if in the referral you got the information, the patient's name, date of birth, if you get Social Security or you don't, unknown, you can change these things. If you get the person's address, add it in there. ICD-10 category, many people in legal services are unfamiliar with this, the concept of an ICD-10 code. ICD-10 codes are ubiquitous in healthcare. They are everywhere all the time. They help document diagnoses in the course of an illness, disease, or injury, and they're also used in billing. So healthcare providers live and breathe ICD-10 codes all day long. So for example, we could choose, this is sort of the big level, the category. As you saw, there's maybe 12 or 15 big categories. Then you could choose chronic disease and then asthma. So you're able to track this information about a patient. Of course, on the healthcare side, the patient you would expect would have signed a HIPAA release before the healthcare provider is sharing this information with you. Then you can also track information about when you receive the referral. Here, I can show you how it works to enter in the healthcare institution. You just put in, do a quick search, and then the different options come up for the institution's department or location, where it's coming from. You can track also where it's coming from in this way. Maybe it was coming from the community health center, but within pediatrics. And then who is the person who sent it to you? Is it a physician? Is it a social worker, a medical student, nurse practitioner, whomever? It can help you track where within the institution that's coming from. If you want, as we talked about, you can also track the individual person who made the referral. So I could add Dr. Sandel there. And then, of course, the legal problem code and notes. Then for pre-screen status, once you've entered this information, maybe your intake specialist makes a call immediately to the patient, gets through on the first time, then they can immediately start a full intake, and all of the information that's been entered here will convert over into the intake. Or maybe that you have pending a callback, you call the person or you're going to call them later, you had to leave a message, whatever. And then it will show up on the home page. So you can see here, I have some callbacks to do. Ron Weasley and Professor Dumbledore, I need to give them a call back. All right, so moving on from that, even if you don't track, maybe your MLP clients contact you directly. Maybe you don't get information about them from the healthcare partner until they call you, but you're certainly going to be doing an intake for that person. So jumping over here can show you doing some MLP specific questions for an intake. I've skipped all this information. This is all very typical information that's going to be collected by LSC or non-LSC funded programs. And then I selected as my intake program, or this automatically populated with MLP Medical Legal Partnership. And then whatever kind of information you want. So if this information had been filled out during the referral that I was entering, it would show up here. So Metro General, Family Medicine was entered before. This in the same place, you could add Dr. Sandel there. If she had already been added, she would show up here in this list of case contacts. Here's some other MLP specific fields. MLP special population, that's something that the National Center for Medical Legal Partnership is asking all MLPs to track when they're serving patients who fit into one or more of these 5 special populations. And certainly many people could fit into more than one of those. You can also add family members here. Medical record number. When I was still practicing, it was very nice to have that at my fingertips. Another nice field that I think is very interesting and also quite helpful came out of one of our pilot sites, suggestion they were already doing this, are patient social determinant of health risk factors. So SDOH stands for social determinants of health. These are things that may have a huge impact on health, even if they're not directly health related themselves. So not asthma, for example, but something that might contribute to someone's likelihood of experiencing asthma or create a barrier to treating their asthma. You can choose more than one of these. So on. More fields that we created, again, getting this information from the local MLPs who were participating in our pilot project and the others who were contributing to our thinking about what fields. The ED stands for emergency department, so the number of ED visits in the past year, the number of hospitalizations in the past year. A number of MLPs are focusing on pregnant and parenting patients, so you could ask questions about is the patient pregnant or postpartum? Those of you who do LegalServer, you could set up branch logic so that these questions only showed up in certain circumstances, or that this question, how many weeks pregnant, would only show up if you clicked yes. And then I also wanted to note the MLP iHelp category. Medical providers think about the types of cases we might work on in one of these 5 categories. It's a I for income and insurance, housing and utilities. E in iHelp is education, employment, legal status, and personal and family stability. So these are meaningful categories to our healthcare partners. Our legal problem codes and special legal problem codes are not so important to them and can be confusing to them, which is one of the reasons that we came up, that Dr. Sandel and others came up with this iHelp mnemonic. I was trying to think of the word mnemonic before, and now I remember it. So you can enter that there. And then another idea that we got from one of our pilot sites is reporting back to your healthcare partner what happened to the referral. So you can say intake completed and case accepted. Maybe the patient didn't actually have a legal issue, they didn't respond or whatever. But you're able to let them know, of the people you referred to us, we completed 85% of the intakes, and here are the reasons we didn't complete or couldn't accept the cases for the other 15%. All right, and again, this is totally customizable by the various sites. So there may be some of these fields that you think are very important for you. If your program doesn't often work with pregnant or parenting women, or has focus in other areas and you don't want to use those questions, you certainly don't need to. Next, I want to show you some features that we added for cases that have already been open. So we created an MLP profile view that sites can choose to use. Some sites that use LegalServer use a lot of these. Others may not use it but may want to for MLP. But it's basically your case handlers, your staff, can choose to have their cases default to an MLP profile view, or they could go to that profile view from anything. So here you can see for MFY, they have a number of profile views, housing project, whatever. And then the information that's at the fingertips of the case handler are relevant to the type of case that they're working on. So for example, here for Professor Dumbledore, I have an open case. I can get basic information about his referral, where it came from, when it came, then more information about Professor Dumbledore's medical record number. Is he the patient referred? So for example, if you work a lot in pediatrics, it may well be that the client is the parent and is not actually the patient. If your client is not the patient, then you can choose their relationship there so that you can note and report on that. Anything that's in blue can be edited right here from the profile. Down here, you can see other household members that have been added, and then MLP special population. We talked about this before. We listed Professor Dumbledore as an older adult and a veteran. Health information. These are some of the things that we've gone over before. Legal case information. There's the iHelp category there, funding code. And then I also just want to show some end of case information that you might want to track. Again, here's the outcome of the referral. We talked about that earlier. Another site tracks the outputs, so what they did for the patient, and share that information with their healthcare partners. Because sometimes the healthcare partners get a little confused about what exactly it is that the paralegals and lawyers are doing, and the site found it very helpful way to communicate about what they were doing to their healthcare partner who invests in their MLP. And then also a summary for the medical record. This is something that we did regularly when I was still in Cleveland. and I know that a number of MLPs do this, it's very important that you let the person who referred the case to you know what happened. Of course, always with the client's permission. In my experience, 99% of the time, the patient affirmatively wanted me to share that information with their healthcare provider. But the healthcare provider needs to know what you were able to achieve on behalf of their patient for the patient, but also for them to understand when and how they should be referring patients to you in the future. We call it the summary for the medical record because as time went on, we realized, we suspected and then realized if we had a client coming back and we're back looking in their medical record, that very often the provider was cutting and pasting whatever we had put in our email into the medical record. So it just affirmed that it's very important to be very thoughtful about what you're putting in there because it may well be that someone other than the referring provider is going to end up reading what you wrote. And again, always with the patient's permission. If the patient didn't want us to share that information, then we would not. Okay, very quickly, some of you who use LegalServer may use a special program page or may be used to a special form where you can edit MLP information. If you just have one or two pieces of information that you want to edit, it's very easy to do it here just from the profile. But if you want to do it all at the same time, or you know that you've gotten a lot more information than you had when you completed the intake, then you can go up to another form. So you can see here, edit MLP information is what I called it in this site. If you call them special program pages, you could call it special program MLP or whatever makes sense for you. And then basically all of your MLP relevant information is here all on the same page. You can put it all in there and then save it all at the same time. Okay, I'm going to shift gears a little bit away from cases to talk about what we call MLP Consults. So many medical legal partnerships invest quite a bit of time and energy into providing legal information to their healthcare partners. So these conversations may take place in a formal setting. Quite often they literally happen in the hallway when the provider sees you and says, oh yes, I have this question about this family that I saw this morning. And it can be hard, historically it has been hard for MLPs to track these because case management systems weren't really built to track these with any kind of detail. And really, I think MLPs, more than any other kind of project within a legal services organization, do this kind of work. And one of our sites did more than 250 of these consults in the first year of operation of the MLP and was tracking it on an Excel document instead of in the case management system. And so we wanted to make it easier to do that. So an example of what an MLP consult is I can give one from when I lived in Cleveland, worked in Cleveland with Metro Health and the Legal Aid Society of Cleveland. One of the providers stopped me in the hall and said, Mallory, I have this family, they've had all these terrible things happen to them, and then they're homeless. They've been homeless for 6 weeks. They got evicted from their apartment because they couldn't pay the rent, and now they're staying with an uncle, but in a different school district. And now the children's school, where they started the school year, is giving the mom a very hard time, saying that they're not allowed to go to the school anymore because they moved out of the school district. So those of you who practice in this area know there's 3 magic words, McKinney-Vento Act, that can be invoked to protect students who are homeless. So I had a quick conversation with that pediatrician. This is McKinney-Vento Act. They need to say those exact words to the school district. I talked to her a little bit about what homelessness was under that act and said that the children should be allowed to remain in their original school district through the end of the year. And also the school district could not kick them out and had to give them transportation from where they were staying back to their original school. So she was able to relay that legal information to the family who used the magic words. The children were allowed to remain in their school, and the school district provided transportation to them from where they were staying. So that was a huge huge useful information for that family, but I never met them. I don't know what the parent's name is. I don't know what the kids' names were. And so I couldn't open it as a case. I didn't know, a lot of information that I would need for a case, but I still wanted to track it as very important information that I had shared. So that's what we are trying to do here with these MLP consults. You can track a lot of the same information as a case, where it came from, who referred it to you. Most times you're not going to know the patient's name. If you did, you most likely would be opening up a case, but sometimes people might find out the name after the fact and want to track it. You might want to track the age and zip code, maybe the ICD-10 diagnosis, and again, the type of problem. So this one here was a question about immigration and U visas. I help category here, legal status. And then for those of you who are LSC funded and need to report on these LSC other matters, you can show where that should fall in your matter reporting code. And for those of you who use LegalServer for outreaches, every outreach has its own email address, similar to the way that a case does. And so if you were exchanging some emails back and forth with a provider about a case, about a patient matter, those could go immediately directly into your outreach. Also, if you uploaded any documents, if you shared maybe an information sheet about what is a U visa or whatever. So this is a really nice way to track that information. Some sites, I will say, I'll also note, will do that as a group intake. So they will do it as a case, but the case name will be the name of the institution. So for example, the group would be Metro General Hospital, and some sites do prefer to track it as a case as opposed to an outreach. Okay, I also wanted to talk very briefly about an MLP facilitated referral. I'm not going to show you one here just because there's a lot of different ways that you can do this inside of LegalServer, a lot of different ways to think about doing it. And I go into more detail on that in the configuration guide. But these are some programs spend also quite a bit of time and energy placing patients with other legal services organizations in their community. So for example, maybe I'm an LSC funded organization and I don't do any immigration work, even the immigration work that's allowable under the regulations. But there's a very great organization in town, the Immigration Law Center, and I spend quite a bit of time helping get survivors of domestic violence over to the Immigration Law Center, not just giving them the phone number, but knowing the intake rules or priorities for the Immigration Law Center, helping getting together medical records that could help support and document the abuse that the patient had experienced, talking with the intake coordinator at the other organization, and so on. So there are a few different ways that you can track that. Some people might want to do it through refer and reject. Some people might want to do it through an outreach. Other people might want to count it as a case if they're giving some basic legal advice, even if they're not providing legal representation in that matter. And then in the interest of time, I'm not going to show a sample training either, but you can imagine that you could set up the MLP fields to track MLP relevant information for trainings that you conduct for your healthcare partners. Okay, I'm going to go back for 1 minute here and get us back with our slides. And this also is not officially part of the configuration guide, but I wanted to put in a little bit of a plug for this white paper, which was put out by the MLP of Southern Illinois, and is wonderful and interesting and thought-provoking. And it helps legal services programs think about ways that they might add projected health impact outcomes tracking along with the legal outcomes that we're all used to tracking for all legal programs. And Sharina is going to put up the link for where you can download this if you haven't seen it already. And I'm just going to go back to my desktop and show one quick example about what this might look like, and also gives just a couple examples of the health-related impacts. Okay. So here I am closing a case of Professor Dumbledore. And up here, I might have closing codes that look very familiar: prevent eviction from private housing. These are IOLA-related closing codes for New York State. But we also added MLP projected health impact. Tied them to various legal problem codes. So here, this is a housing-related case. These are different projected health impacts related to housing that the paralegal or attorney who's closing the case could choose a variety of different health impacts that they project will result from the work that they did. I do want to note this is not for those of you on the healthcare side, this is not something that comes out of research, but it's something that we hope in the future will be a subject of research and evaluation to be able to better confirm that these health impacts are in fact resulting from the legal work. But we have to start tracking the data in order to give researchers some things to research. So here are just some examples. Let's see, in this case, Professor Dumbledore, I prevented his eviction while he was in the hospital, let's say, and I also got some repairs in his apartment. Let's say there was a hole in the floor of his apartment, and the landlord was trying to say he couldn't come back to the hospital, that he had been evicted while he was in the hospital. So if I prevented him from being evicted, I mitigated his risk of homelessness. If he got repairs in his apartment, we improved the habitability of his living conditions. If there's now no more a hole in the floor of his apartment, we reduce his risk of injury. And then also, if he's in the hospital and feeling like he's going to be homeless when he gets out, and now he's not going to be homeless, then we project that we've improved the ability to prioritize health and healthcare where stress was interfering with that care. So again, that's not specifically in the configuration guide at this time, but I do encourage people to download that white paper. Okay, so just a moment, I'm going to come back here to the slides. Okay, so we're going to pause for questions here. We've got another wonderful mural from Cleveland. This is actually Barley. It's in Market Square on the near West Side, near the West Side Market, and also near a great brewery called Great Lakes. So I'm going to see if we have questions here, which I can't see when I'm sharing. So I see that there's a question about, we do not use LegalServer. Is there any plan to integrate into other platforms? So the answer to that is yes. We are hopeful that we'll be able to expand this into PICA, Kemps and Prime, legal files, and towards the end of the presentation, I'll talk a little bit about how people who use those programs, one, can benefit from the configuration guide, and also can be in touch with us about having further conversations about expanding that way. Okay, I'm not seeing other questions right now, so I'm going to go ahead and move on. I'm going to talk about the configuration guide itself. And again, the configuration guide was created for people who use LegalServer, but I do think that it would absolutely benefit people who use other case management systems and are starting to think about how they could be customizing their case management system. I think it's also helpful for those of you who are on the healthcare side, who are thinking about what you would like your legal team to be tracking in terms of data. So if you hold on again, I'm going to go back to my screen sharing and pull up the guide itself. So I'm also going to ask Sharina if she can please share the link in the chat box for for you to download this. We, of the total people who have downloaded the guide, there are actually more people on this call than there are people who have downloaded the guide. So I know that there are some of you on the call who have not seen this before. Again, I think it's useful for you whether you have LegalServer or not. Here, I'm just going to quickly highlight, these are the wonderful programs that participated in our pilot. And then note that in this guide, there are the checklists we're going to talk about. We're going to talk about the instruction sheets. There's also a list of all of the fields, blocks, and list views. That's something that I think is helpful for everyone, regardless of whether they use LegalServer or not, as well as the glossary. And in fact, I'm just going to slip back here to the back. You can see the glossary here defines the different fields and also defines things like what is an MLP consult, what is an MLP facilitated referral, and so on. And then here is the list of fields. So again, these are at the very back of the guide, and I think that these are interesting and informative for everybody, regardless of whether you use LegalServer or not. But first, we're going to talk about these checklists. So these checklists are for the MLP team, and that's the legal team as well as their healthcare partners, to kind of review and think about what information they want included in LegalServer, or if you use another case management system, thinking about what you would want in your case management system if it had similar features. So there's a bunch of different checklists for you to go through. Here's medical institutions and departments. So this is just an example one. If the institution name is Busy Health Medical Center, and then these are the 4 different departments where you accept referrals or consultations from, you can fill in that information there, and then you can turn this over to your LegalServer administrator who can use it to enter the information. Checklist 2, I'm not going to go through all of these, but I'm just going to give a quick highlights. If you want to track the individual MLP providers so that you can more easily track who exactly is sending you cases, you can track that information here. Then for the drop-down menus, you can choose the values that are relevant to you. So for example, medical practice area, these are the practice areas where you're taking referrals. Maybe you're taking them from the main campus of the medical center department in pediatrics, but you also go to a community health center and they have a pediatrics department, and you want to track that separate from, you know, the family practice referrals that you get in those 2 different locations as well. So if you only accept referrals from 3 of these areas, then you just click yes, you want 3 of them and you don't want the rest of them, and only the 3 that you need will show up if you're using LegalServer, and I believe that you can do that in other areas as well. Same thing, referral position type. If you're only taking referrals from social workers and attending physicians, and you never take referrals from medical students, then you don't need to include medical student in your list. Then the last one that I'm going to show is if you, in fact, want to set up an MLP intake, for example, like I showed earlier, then you can go through and say, yes, I want to use this field, or I don't. So if you don't want to track the date the referral was received, you don't have to. If you don't confirm back to the healthcare partner that you received their referral, you don't need to use this field. And so it's up to you to think about what best meets the need of your medical legal partnership and your patient population. And then we always leave room at the end. This is the intake, so it has a lot of questions, a lot of options here, to create your own. So you may well have fields that are specific to your medical legal partnership. So these are not going to show up in LegalServer, but you might want to create them for your own site. So we created those for all of those sections as well. Okay, I'm going to go back to our slides. Just one moment here. Okay, another one of my favorite murals. This is from the Glenville neighborhood in Cleveland. I'm going to check again on questions. So I see, thank you, Sharina, for the link to chart it. Okay, we have a question about a custom field that talks about cost effectiveness, acknowledging that that's a big complex question. So that's one of the things that we'll be thinking about in the future, is how best to track the financial outcomes related to MLP, both the financial outcome to the patient, him or herself, or the patient family, but also the financial impact to the healthcare institution. And you're right, it is a big complex question, and that's one of the things that we have on our agenda for the future, but is not addressed in the current draft of the configuration guide. Then there's a question, a method to auto-load information from the medical provider. The legal team can type in the information about the various medical providers. And if you use the online intake module for LegalServer, then you could have medical providers enter the information themselves. So if that's something that you have as an option. Okay. Oh, okay, sorry. So the question that I just responded to was a question about, is it possible to auto-load information from the electronic medical record into LegalServer? A wonderful question, something that we're thinking about as possibly, including as part of a TIG application, Technology Innovation Grant application to LSC, is thinking about how LegalServer and other case management systems could communicate directly with electronic health records to share agreed upon information. So again, that's a bigger question, but an interesting one and an important one. So not addressed here today, but will be addressed, we hope, in the future. Okay. Then very briefly, I'm going to go through instruction sheets. And this is, I'll just do this in a couple minutes here. This is really for the LegalServer administrators. Let me close this out. Whoops, nope, I want it open. Hold on one moment here. I'm just going to pause my screen sharing. And I'll just explain. I was a managing attorney. I was a supervising attorney of the mental health law project at MFY most recently. And that's where I learned to be a LegalServer administrator. MFY moved over to LegalServer as its case management system. And I learned how to do some of the setup when we did the migration. But I had a lot of other things that I needed to do, supervising my staff, worrying about my clients, thinking about policy projects, those kinds of things. And so I made these instruction sheets with my old self in mind. I kind of knew what I was doing in LegalServer, but I didn't totally know what I was doing in LegalServer. And if somebody had asked me to set this up, I would have needed a lot of help. And so I made these with my old self in mind. So if you are a less experienced LegalServer administrator, or you have, 5 or 6 other hats that you wear, which have prevented you from becoming a LegalServer expert, these were made with you in mind. So they're just very, very step-by-step. First you do this, then you do this. It refers you back to the checklists that your MLP team will have figured out or will have filled out so that you can go through. So this document is many pages, but you kind of fly through it when you're doing it. And again, it's just we're created in mind with people who have a lot of things on their plates and really need spelled out exactly what to do and how to do it. And these are broken down similar to the checklist into different instruction sheets. So there's one for setting up intake. There's another one for setting up a profile view. There's another one for setting up MLP consults. So if you decide you don't want a profile view, you can skip that question. If you're not going to track MLP consults, you don't need to set that up. You can skip that instruction sheet as well. Okay, we're going to go back to the slides. This is for the dog people. This is an incredibly cute dog, and I thought maybe we could all just use a picture of a cute dog to kind of give us a chance to take a breath. And also, actually, very quickly, I'll tell you a quick MLP Consult story involving a dog. This is actually a veterans-focused MLP consult where a psychologist from the VA contacted an MLP attorney to say, we have a veteran that we're very, very concerned about. He's very, very depressed. We just completed a suicide prevention plan for him, and we're trying to talk to him about things that were important to him. He's very isolated from his family. Most of his family is living in another state or in his home country. We asked him what he would want to live for, and he loves animals. He said if he could have a dog, that would be something that would be incredibly important for him. And so with him, we asked his landlord if he could have a dog, and the landlord said, no, this is a no pets building. We don't have dogs in this building. He may not have a dog. So the psychologist really didn't know where to turn, called the MLP attorney, who shared the magic words, reasonable accommodation request, helped review a letter that documented why it was related to this veteran's disability, why he needed to have an emotional support animal, and kind of what the relevant laws were in addition to the magic words. And the psychologist called the MLP attorney back in 2 weeks and said, we have had an absolute 180 here. This veteran has had a total turnaround. The landlord agreed that he could have an emotional support animal. He went to the local shelter. He has a dog. He's getting up every morning. He's going out into the community with his dog. He's making new friends. The dog is making new dog friends. We can't believe it. Thank you so much. So a wonderful, wonderful story, a huge success story. And again, a case where we wouldn't have opened a case because the MLP attorney never met or spoke with or knew the name of the veteran who was involved in that case. So sweet, sweet dog. Okay, getting ready to wrap up here. I'm going to answer a few more questions, and then we'll go through the highlights here. Oh, people like the dog. Good. I know the dog is so great. And then how long does it typically take for a LegalServer person to make the MLP changes and additions? So I always recommend putting things in your demo site before your live site just to make sure that everything is operating the way that you intend and you don't mess up other stuff. But I think all told, you would need to spend probably a full day to 2 days doing it. And that's, not having the phone ringing, not having people come to your door. So it definitely takes some time up front, but again, gets you such rich information, and it's going to save your staff a lot of time down the road. As I have said at presentations before, a lot of MLPs that are collecting this data are doing it on Excel spreadsheets, or drives me up a tree, Word documents, or by hand. There's a lot of double data entry. Maybe they're collecting some information in their case management system, but then they're re-entering it into the Excel document that has the MLP related fields, so on and so on. So you're going to save your staff a lot of time. But yes, it does take the LegalServer person, I would say, a good day to 2 days to set it up. Okay, so again, just reviewing the highlights. All legal services work impacts the health of our communities, and we're thrilled to have a lot of programs that don't already have an MLP on the line with us. If you're thinking about getting an MLP, great. Even if you're not, I think there's a lot of ways to think about how the work that legal services programs overall do that's crucial to the health of their communities, and thinking about talking about it in health terms, not just in legal terms. The MLPs, we're doing great, but we need to stick our landing. So we need to pull off of the paper. We need to pull off of the Word documents. We need to pull off of the Excel documents and into our case management systems. There's nothing wrong with Excel. You may dump your data back out into an Excel spreadsheet and do all sorts of wonderful things with it. But we need to make it easier for our staff to collect the information, and we need to make it easier for supervisors, managers, grant reporters to report on it. Again, we're in the early phase of a long journey, so this configuration guide, I think, is a very, very important first step, but it doesn't answer all the questions that we need to answer. It's not the end of the story. We're going to be working on this for some time to make sure that we're getting it right, and especially as respect to outcomes. Again, it takes time up front to customize LegalServer. I do think it's going to save you a lot of time down the road. And also, as I've been saying, that we're at the beginning of this conversation, and some of the additional things that there are to come are sample reports in LegalServer that could also be used by other case management, people using different case management systems and thinking about setting up their own reports, tracking these outcomes, including the financial outcomes, financial benefits to the patient as well as financial benefits to the healthcare institution. And like I showed with that very simple question that you could be asking intake callers about where they receive their healthcare, using some pretty basic data as a starting point to spur healthcare investment in what you're doing. Okay, so in response to our early adopters who participated in a similar training in June, they were hopeful that they could have some ongoing support for what they were doing after they had a chance to really delve into the materials. So we are going to hold 1 hour office hours once a month through the end of the calendar year. The first of those office hours will take place on Friday, September the 16th. You can see the various time zones there. Sharina put the link in the chat box. You can also find that at medicallegalpartnership.org to register, and it will be scheduling additional days for October, November, and December. So you can keep an eye out for that over the MLP update and on the medicallegalpartnership.org website. That's the website of the National Center. So it's 3 o'clock. I want to be very respectful of your time. Thank you so much for participating in this training. If you have additional questions, please don't hesitate to be in touch with me. You can see my contact information there. Please also be in touch if you use PICA, you use KEMPS or Prime, you use Legal Files. If you would be interested in being part of the conversation and setting up some uniform, universal MLP fields in those case management systems, and if you have questions about LegalServer generally or would be interested in being part of that ongoing conversation, please be in touch with me as well. So thank you so much. I'm going to turn it over to Sharina for the final thank you and goodbye, but I appreciate you taking the time out of your very busy day to spend this time with us.
Thanks so much, Mallory, and thanks so much to the team at NLADA with Radhika and Ariel. We really appreciate the time that you spent with us today. And if anybody has any questions or follow-up, please don't hesitate to contact the National Center or Mallory directly, and we can give you the resources that you need. Thank you so much, everyone. And tomorrow we're going to send out a recording of this webinar session along with a PDF of the PowerPoint. So thanks again. Bye.